Hello, everyone, and welcome to today's Red Saree webinar, Heart Healthy for Life During COVID-19, featuring Dr. Angelica Hardee from the American Heart Association. My name is Kamala Nelson. I'm a senior at the University of Cincinnati and a member of Red Saree Youth. I will be your moderator for today's session. Before we get started, I would like to discuss a few points regarding housekeeping. First, I would like to ask you to please mute your microphones. We ask that you please submit any questions through the chat box, and these will be read by me during a question and answer segment at the end of the presentation. Additionally, this webinar is being recorded and will be made available on the Red Saree Facebook and YouTube channel. Without further ado, I am very pleased to introduce Dr. Hardee. Dr. Hardee is a three-time alumna of the University of Cincinnati, where she received her bachelor's, master's, and doctorate degrees in public health. As Vice President of Health Strategy for the American Heart Association, Dr. Hardee currently works to assess the community health needs within the Greater Cincinnati and Northern Kentucky region to develop, support, and execute community-wide strategies to build a culture of health. I would like to thank Dr. Hardee for being a part of our webinar series, which is designed to further Red Saree's mission of promoting a healthier and happier lifestyle for South Asians through education and advocacy.
Thank you so much. It was such a nice introduction. I'm very excited to have this conversation today. We will be able to have access to this presentation after. I will tell you there's a lot of info in a short period of time, so I definitely want to be able to get through all of the content, and then I'm very excited to answer any questions that you may have after the presentation. So, hi. I'm Angelica. I'm Vice President of Health Strategy, and as Kamala said, I lead a lot of strategy work specifically related to tobacco, hypertension, and food access currently. But as the history of AHA, we've also been doing a lot of things when it comes to heart health, because we know there are so many important factors to keep our heart healthy. So, why it matters, and I think this is hopefully why everyone is watching today. We know heart disease is the #1 killer worldwide, but specifically for individuals of South Asian descent in the U.S. suffer greatly from heart disease, high blood pressure, and diabetes, and then are 4 times more likely to have heart disease, 10 years earlier to have a heart attack, and then 50% higher to actually have mortality related to heart disease. So when we talk about what are the health disparities when it comes to various ethnicities, it's super important that we point out where we need to do the work and why it matters when we specifically talk about research, programming, and prevention efforts. That is why. And I love starting with all the data, starting with the science, because we know what we need to work on. And then my wonderful job is how we work to do it. So another reason why it matters, we want to see a world free of cardiovascular disease for everyone. So the things that I talk about today are not new necessarily. You may have heard them before. They're not new. I didn't make all this stuff up myself. This is science, evidence-backed. But it's very important because of the way we actually work to be heart healthy, and not just, in this hopefully shorter period of COVID time, but going from years and years to come, is to really change our health and our heart health overall. So we want to see a world free of cardiovascular disease, and that can be prevented actually by making healthy choices. Over 80% actually can be prevented by healthy choices. So first, the thing that we talk about all the time, but it's actually the most difficult to actually achieve, is our poor diet. So that is one of the largest challenges when it comes to heart health, is just our diet in the United States. We have seen over the years in research and data, and even know that now, corporations and we've made things bigger than they used to be. So it's not even all of our individual fault, because things have just gotten larger in size. Our portion sizes are larger. How much, you can make it double it, or make it a Big Mac, or whatever you can do, make the sizes larger. So we've seen over time that we as a country have then become unhealthy because of all the access to unhealthy foods, and I would also say convenience. So only 1.5% of American adults actually eat the type of diet that you need to be heart healthy. Now, doesn't mean you can't indulge in having a good thing every once in a while, but it's very hard to keep a heart healthy diet. And often consumers, individuals are challenged by eating right. And even though we know we're supposed to, so often these unhealthy foods are just so easy to access. So at the AHA, we recently came up with Healthy for Good. We most often, as research changes, as we learn more and develop more, we come out with different campaigns related to heart health, and they can be a variation of things. But this one is Healthy for Good. It was a revolutionary movement that we have now to inspire and create lasting change for your health, one step at a time. I think so often we're just so inundated with so much information when it comes to what to do to be healthy. You know, there's fitness people on one side, there's different weight loss pills on the other side. So there's just so much information. And AHA did a lot of work to have some evidence of like, what are simple things that we can do to improve our health? These are not like rigorous, and they're also, we think about access is really important with this too. So how can everyone have the opportunity to do that, even if they don't have all of the access? So being healthier is bigger than just a one-time decision. So it's a domino effect. Some days we have bad days, some days we have good days, but working one step at a time is extremely important to really align with different methods, different behaviors, and really changing those behaviors, and then being more knowledgeable. And in this picture, he's looking at the back of about just looking at the nutritional facts that are there, and then making sure that you're abiding by those. But we have to start thinking about looking at that rather than just taking and not just making the choices without knowing what's in our products that we're eating. So as I mentioned, science and evidence-based. So we literally taken tons of healthy living recommendations and really turn them into easy to understand advice, tools, and shareable science. So we're not going to have any crazy terms or anything in this conversation today. Definitely something very easy to digest, literally and figuratively, and then actionable information to be optimistic and inspirational, because I think it's so important that we don't harp on the negative when it comes to our heart disease and health, but encourage and empower individuals to make healthier choices. We know that works. When people feel empowered to choose healthier, they more often are. But when they are saying, well, if you do this, then this will lead to that, it's a negative connotation of how you speak to individuals. We know that does not work. For years, it didn't work. So we really wanted to start saying, making this better choice is healthy for good. And then also movement, things you can do, customized motivation, and then ongoing motivation for longer, healthier lives. So not just stopping one day with this encouraging healthy life, but for a long, long time. So it's in 4 different parts. Eat smart, add color, move more, and be well. We put eat smart and add color kind of together because obviously that's our healthy eating. And then move more and be well are also extremely important. So let's start with eat smart and add color. So obviously eating smart is healthy eating starts with healthy food choices. So you don't need to be a chef or to make heart-healthy meals for your family that they will love. And I'll also do a shameless plug. If you are ever looking for heart-healthy recipes, AHA has heart-healthy recipes for free on our website. You can just go to the AHA and search recipes, and you will see tons, way more than you want, actually. But definitely fun to do quick or long meals that you may enjoy that are heart-healthy, that you can do for your family, as well as, if we could go back to work, when we go back to work and have potlucks and things of that nature, to really start continuing having healthy choices. So another thing that I used to do when I was a lot younger, because I was so used to seeing the heart checks, but I don't know the last time you checked for a heart check in a while, but they're still on the one thing that everyone thinks of is Cheerios, right? So Cheerios has a heart healthy check. There are also many other products that have heart healthy checks, and really starting to think about those. When you think about nutritional facts, like this is a good thing to buy. So simply look for that familiar check when you're looking at your packaged food, to know that they're heart healthy. So that's something that we used to do all the time, but we kind of just forgot about it. It wasn't something that we often look at, but that's still really important. And then adding color. So eating a healthy diet is rich in fruit and vegetables for a healthy life. So the first step is including those fruits and vegetables at every single meal, from the snack to dinner time, and then having them fresh, frozen, dried, all of those. We also have some suggestions if they are canned, right? So we know sodium content is really important. So what you can do if you only have access to canned vegetables. So we really want to make that accessible to everyone. So what you can do, and rinsing, making sure you don't use the whatever the vegetable is canned in, and using water instead. So just making sure that everyone has access, if they don't have fresh produce all the time, that they can have these colors or meals with color. And then going from eating healthy, moving on to the next situation. That is that only about 20% of adults actually get physical activity that meets the recommendations. So we started off with 1.5 when it came to diet, and then we moved to physical activity, we have 20%, which is better, but still not where we want to be. So inactivity, we know for a fact, increases the risk of death from heart attack, stroke, type 2 diabetes, colon cancer, lung cancer, etc. So we really want to make sure that people are being more active. And I think this is the part where people are like, I try, but sometimes I can, or, just it's very intimidating when we say physical activity, because everyone thinks they have to be a bodybuilder or some type of triathlete. And that's not necessarily the case. 30 to 50% of adults who perform little to no moderate exercise to vigorous activity have valuable benefits by replacing just sitting activity with light activity, right? So I love this slide because it's like the most logical, right? Walking your dog, right? So just thinking about, or maybe you want to get a dog so you can walk it. I mean, who knows? But just thinking about the importance of that, and knowing that it is, small changes when it comes to physical activity can make a huge impact long term. So that's also pretty important. So going on to our move more section. So our recommendations when it comes to physical activity is getting 150 minutes per week of moderate to intensity aerobic activity, or 75 minutes of vigorous activity. So that's like a combination of both. That can be, moderate, taking longer walks, or power walks, which are super fun. As you can see in the slide, they're doing a class, some type of Zumba maybe, or some type of dance class as well. But really incorporating more physical activity in the day. Finding what you love and really starting to stick to that and just be consistent, because it'll help your heart health in the long run. And then now we don't have this problem maybe as much, because a lot of us are still working from home. And if we are working in the office or back in the office, we may have a different schedule. We may be up and down. It just looks a lot different in this current time. But even while you're at home, and I'm personally am guilty of this, I can sit in front of the computer for a long period of time because I forget that I'm sitting so long. But it's so important to move more and sit less. So however you can incorporate that in your day, make sure you're doing it. If you're standing, you are more likely to then walk somewhere or move and make sudden movements. I know I personally, invested in a home standing desk because I knew that I will literally sit the entire time while I'm at my desk, just because I start working and I never look back up. So that's one way. We know that adults who sit less and do more activity have greater health benefits, and our work schedules now, so often a lot of our jobs are so sedentary lifestyle. So we want to make sure that we're doing everything we can. I know I have a couple friends that have medicine balls that they sit on. That's supposed to be working their core, but it also makes them stand up because sometimes they don't want to sit on their medicine ball anymore. It's not very comfy. So it's just thinking of little things you can do, setting an alarm to get up and walk around the office or walk around home, or I've personally invested in taking little breaks in the middle of the day where I'll just, well, not anymore because it's very hot outside, but when it gets a little cooler in the evening, I'll go out and I'll take a walk, and that'll just add to the activity that I have during the day. So just thinking about some of how we really modify how we move. And then those, I already kind of talked about the sedentary lifestyle, sorry. Getting up and moving at any level lowers the risk of diseases. So it's just so important. Even if it's a small change. I know I've encouraged my parents to make sure they're taking walks after dinner. So often we have dinner, about an hour or so ago, and they're like, well, not going to do anything. You're going to enjoy a TV show maybe, but going for a walk after dinner is a great thing to put into your lifestyle as a norm. And then what else small things can you do? Stand up to make phone calls, get up and stretch, have a short walk, and things like that nature. So we gave some actual tangible tips. So with the Move More, 10 minutes of stretching is great, as well as 2.5 hours of walking every week, right? So you can break that up. And then 30 minutes of tennis, or it's like walking a 5K. If you're like me and not the best at tennis, you might just want to just walk the 5K. But whatever works for you. Vacuuming is also really good. Not my personal favorite as a chore, but it's a good thing. Just thinking about how else you can have activity in your life. And then dancing, if you love to dance, thinking about how those are physical activities. So often we're so low down, we're like, I need to go to the gym, or I need to lift weights. But start small and figure out how to put those little activities throughout your week or your days, and then you can figure out how to incorporate more. And then grocery shopping. No, we're not staying in the grocery store super long, and it's not like as leisurely as it used to be. But even 30 minutes of grocery shopping a week for a year is like walking a marathon. So that made me really happy, because I was like, I definitely spend at least 30. I used to spend 30 minutes in there. Now I'm just like, get in and get out. I have my mask on and can't touch anything. Just a lot going on. But when we get back to normal, you'll just think about you ran a marathon or walked a marathon by going to the grocery store. So, and then add intensity. I mentioned a couple of those things, but really find what works for you. Have some examples. Walking, I mentioned gardening as well, ballroom dancing if you have that coming up, yoga, and tennis and things of that nature. A lot of people have been bicycling because of social distancing and COVID, which is great because now there's no bikes, because I need a new bike and I don't have one now because everyone is riding bikes, which is great. So just thinking, if you do have, a bike in the garage that you're not using, just get on that bike and really start going to the awesome trails that we have as well, just to get active. And then more intensity, obviously running, jogging, things of that nature. Jump roping is a great cardio. So you can just do very short and get your heart rate up really quick. And then hiking, it's beautiful. It's summer. Let's take advantage of the time that we have, because we can't do traveling and things of that nature. Let's enjoy the outdoors. And I think that's the great part of okay, this is a perfect time to start just adding small things. Don't compare yourselves to others that are like, I lost 35 pounds in quarantine time. And I'm like, I did not, but I did incorporate more heart healthy things in my lifestyle, and that's good. So whatever works for you. And then last are be well. So mental health and physical health are super linked. So often we have always really focused on heart health being health behaviors that we eat, and then our physical activity. And for a long time, we did not focus on our mental health when it came to really how we take care of ourselves overall. And they finally named stress an epidemic. The World Health Organization did. But after it was named, it's important that we incorporate it in everything that we do. If we forget to look at the mental health factors of all of the things that happen to us, we often are going to definitely miss out on some of the underlying factors of unhealthy behaviors, such as overeating or drinking alcohol and other healthy behaviors that we won't talk about today, but smoking and all of those. So when we overlook mental health, we do ourselves a disservice as a public health professional, but also for, patients, individuals, family members, etc. So the National Heart, Lung, Blood Institute estimated that 25 to 30% of the adult population does not have enough sleep. So that is crazy because I love to sleep. So insufficient sleep and the duration of sleep disorders is definitely associated with negative health factors and cardiovascular risk. So sleep is so important. It's very difficult so often for people to sleep for various reasons. And we know that it is essential to our heart health. So if anything, hopefully, has happened in this lull of COVID time, I really would love for everyone to try to take advantage of how their sleep schedules, what they need to sleep. There are various both holistic things that you can do, as well as some supplements. I personally sometimes use melatonin, which is definitely not a sleep, more of a sleep aid. It's like once you get to sleep, it keeps more of a restful sleep. It's not like a ZQuil, or if you want to think of anything like that. But how you form great sleep patterns, and you'll see that you will be healthier long term. You'll have more energy and things of that nature. So that's one thing that we often just forget about. We talk about sleep. So often, let's just say you decided to get a personal trainer and do vigorous physical activity, and you start all that, but you're still not sleeping well. So just thinking how you can do these small things in each one of these areas, and then go from there. So with our Be Well, we create balance and well-being for self-care. So along with eating right and being active that I mentioned, you may have to make sure you have enough sleep. You practice mindfulness, practicing stress-free things, keeping your mind and body fit, and connecting socially as well. So some of the fight stress healthy habits. First is the one that I try to tell myself all the time is slow down. I don't know if anyone is like myself, but I struggle a ton with just slowing down. I go a mile a minute, and I'm just like, go, 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 go. And I think this time within COVID has really made us slow down. And I am taking full advantage of it on how I just continue to go with my day. I plan ahead. Even though I was planning before, I was just planning things too close to one another. So I was always just rushing from thing to thing. And then I didn't want to, I was not giving my all to everything because I was so rushed. So then I snooze more, as I mentioned. Having 6 to 8 hours of sleep every night is so, so important. Let go of worry. I know that's easier said than done, but give yourself a break and just breathe. I think, in this time, we have really learned that we sometimes don't have all the control over things, right? And this has given some an opportunity to breathe, but obviously many are very stressed. And because of this pandemic has made such a devastating impact on our country and this world, we know that people are not just going to be able to let that worry go. But I think, kind of off script, but I think we can take something and trying to just breathe because we don't have control. Me personally, I, like to have control over everything. So this is a time where I've had to just stay back, do what only I can do. I mentioned going to the grocery store, wearing my mask. Those are things that I personally can do. And from that, it gives me a little bit of let the worry go and just breathe, because there's some things out of my control. So just thinking about how we take these practices going forward. laugh it up. I love that we put that in there. So often we're so like serious and we forget about joy and the importance of joy and what it brings. So laughing and then getting connected. So, you know, this has been a crazy time where we can't be physically connected so often, right? But calling a friend, hopefully FaceTiming, video conferencing, all of those things are so, so important. Social connectedness, and then the research of social connectedness, is becoming more and more prevalent because we're like, what is happening? When we control for all the other variables, we just don't know what this behavior is that people are not having. And so often we're starting to see more and more research come out that social connectedness is essential so often to many health factors. And so often if someone does not feel socially connected, it also is really aligned with like resources as well. You know, so often we are, you know, we find our physicians, we find specialists, we find people from having connectedness with others. We ask those social networks for advice, we confide in them. And those are things we sometimes forget about. But those type of healthy habits of being socially connected really is a healthy, it helps overall with your health. A couple others, getting organized, so getting to-do lists. I have a couple myself on like little sticky notes. I have my little pen pad here. Giving back, volunteering and spending time helping a friend. I know that right now it's a little bit more difficult to volunteer if we often are not physically in one place, but if you have a skill set and it's something that can be virtually given, I have a couple friends that are therapists that were giving sessions to youth at the time for parents, or for the youth, for their parents, and that was like an awesome thing. They're like, well, I'm a therapist, I have my patients that I have, but what if parents don't know if their team needs to talk? So that was something that they can do. But thinking if you have a resource, how do you give that back? And those type of healthy habits really do help. Be active every day. We talked about that. Give up the bad habits, talking about alcohol, tobacco, excessive caffeine. So a little caffeine won't hurt anybody, but excessive caffeine, we definitely want to watch that. And then lean into what you can change. And I kind of mentioned that of like breathing, right? So what can we control in this time? What can we do during this unique time in our lives where we hopefully maybe won't have a time like this in our lifetime again? And because of that, what can we do? What skill can we learn? What goal can we have? And then those are also ones that are attainable to us, right? I think so often now, because everything is so virtual, we're often, you know, looking to others for those. And we really want to see what something that we personally can do and take and be healthier overall, and not comparing that to others that are also doing, you know, crazy, amazing things in this time as well. But those are not your personal goals, it's someone else's. So, and then our goal overall is to continue to focus scientific evidence programming advocacy to eliminate heart health disparities in South Asian Americans. And these hearts actually link to different articles that AHA has done over the years, both some within advocacy, and there's 2 published articles from like 2018 and 2019 of like research that I mentioned earlier. And I wanted to just give those as a resource that no individuals will be able to access this presentation, because I don't necessarily have the time to like go into those articles, but they give more details about how it is essential to provide scientific evidence and for us to make sure that individuals, we have the evidence, because if we don't have the research backing it, we often don't see policies, systems, and environmental changes happen. We need the scientific evidence to say this is important and this is why. So that's kind of something that I wanted to mention. And now I think I did it in perfect time. Now I'm really ready. I hope I didn't go too fast, but this presentation is available if anyone would like it as well.
Thank you so much, Dr. Hardee, for that wonderful presentation. I think it's incredible that no matter our age, we can all implement the suggestions that you made for healthy living. So at this point, let's move on to the question and answer portion of this session. I can read any questions that are submitted in the chat box or via Facebook Live. So we encourage everyone to submit any questions that you might have. I can start by asking a question of my own.
Okay, I'm ready.
My question is, when is it recommended to obtain any form of cardiovascular testing? Is this something that predisposed groups should consider for screening purposes, or is this more related to having specific symptoms or a really strong family history?
Yeah, I would advise, and kind of from putting my public health hat, that's the only hat I have really, is first having a primary care physician, and really starting with a primary care physician that knows you early on. And if you don't already have one, really making sure you're going annually. I say that because, as you mentioned, family history, as well as different signs and symptoms. If you have a primary care physician that you go to for years, they're more often to then point out if there are changes. For example, if they see, okay, your blood pressure is a little high, and last time you were here, it was not. Or we know your family has this, your mother, father, family member has this family history, then we are going to go for this testing. So I would say it definitely varies, but I would say it's essential to have that primary care physician rather than anything, because then they can make a referral when they see or know anything is different, right? They will be the first one to be alarmed. And then even if you personally feel different or something is wrong, having that primary care physician to go to if there are any changes is even better. So it's on both sides, for you, the person, the individual, but also for your physician as well. So that would be my advice. As a public health professional, we are, extreme advocates to primary care. So often we try to self-diagnose ourselves from WebMD, and that's not the way to go. So having that primary care physician to then guide you to, what's best, and, some definitely good recommendations is my recommendation.
Thank you. So I have another question for you, Dr. Hardee.
Yeah.
I'm going to read it from the chat box. What are your thoughts on exercising before bedtime specifically?
So actually, I had that question a couple days ago from just a friend that was like, I cannot sleep. I would say it varies per person. I have not read it, and I could be wrong, but from what I have read, it's not, some people can exercise before bed and go right to sleep, and some can't. So I think there's a lot of factors that have to do with that, but I am not opposed. Some people exercise better at night. I don't know how. It's not for me. But I think it's definitely person to person. I have not seen any data personally that says, exercising before bed is bad, because some people get really tired and they, take a shower and sleep like a baby. And some people have more energy after they work out and then they can't go to sleep. So I would say I think it's definitely a personal thing, and people have to then, try it both ways, see what works for you. Some people say, 5 o'clock is best because I go home, I eat dinner, and then I'm tired, and then I want to go to bed at night. So I would say it definitely varies. So sorry, I don't have a real answer, but I've never seen that it's bad to work out. I've always heard physical activity is important no matter where you can squeeze it in.
Thank you. I have another question, or more of a request.
Oh, okay.
It says, would you please outline the list of local community activities in this line of health choice that the local AHA chapter promotes and organizes?
So right now, everything we have is virtual. So one of the biggest, I would say, move is called Move More, and it's actually a national platform that we all use. It's actually on our Facebook, and we've had kind of influencers and social, what do they call it, personal trainers that do live, like different dance classes, different things of that nature. So we've had that before, and we have like a series that'll happen both sometimes on the weekend, but also sometimes during the week. So that's called our Move More series, and those are super easy to find. I would say following us on the national AHA page, we then post it on our local one because they have, bigger influencers and big platform, and they'll be on like Facebook Live and things of that nature. And we also do the same where we have healthy eating. So when it comes to those bigger things, or we typically follow our national, and then we just it's cool because we don't, we don't have to share the same thing. But then we've also had some cooking classes as well. Those are not as frequent. Definitely the Move More series because people are cooking a lot more at home and they're taking recipes. So we haven't had as many virtual cooking classes, but definitely our Move More series is super fun, super engaging. We also then have just videos. I love Move More. There's this awesome girl that like talks on the videos, and I think her voice is pretty cool. And they're kind of encouraging videos, right? Like, you can get up, you can do this, that I really like. So those are the two with healthy eating and physical activity. And I would definitely say, I already mentioned it when I was doing my presentation, but the recipes that we have, I promise you, they're outstanding. There's something for everyone. And I think that's the fun part about it. You really can find different things that everyone can do. And I think that's fun. Like, kids have some recipes on there, and then there's some ones that are a little bit more for the experienced chef, and then some easy ones that you can have on the go.
Thank you. Those are all really great resources.
No problem.
Another question that I have for you, which is also related to the cooking that you were just discussing. The question is, do you recommend a more plant-based diet for heart-healthy living?
Yes. So plant-based diets are definitely better for heart-healthy living. I think one of the biggest concerns is so often people that have plant-based diets are not getting enough protein in their diet, right? So that's the only caveat of like, make sure you're getting enough protein. And that's the only thing that I've heard that's a negative. But plant-based diets are are definitely better for heart health overall. But it's extremely important to make sure that you are getting all of your nutrients from that plant-based diet. So often we see like, okay, well, I'm only eating, plant-based diet, but we then, you have some deficiencies in your nutrients. So that's important as well, to make sure you're doing that. But it's definitely better. I know some people, even if you can't go to a total plant-based diet, incorporating that, and kind of mention that in our presentation. But I know, meat, I know like little different things, or veggies, or something. So if someone is not willing or does not want to go to a plant-based diet, but having certain days where they do not eat any meat is definitely a small way to start.
Thank you.
No problem.
As a vegetarian myself, I know that it can be difficult sometimes, like you mentioned, to find enough protein and things like that. But like on the AHA website, like you mentioned, there's so many great resources out there to find different ways to incorporate all the important parts of your diet. So thank you.
No problem.
I have another question for you. How can you best monitor your progress for heart health as you incorporate these suggestions?
Ooh, that's a good one. Well, there's so many resources out there. AHA doesn't have anything that's like a personal guide. I think for us, that's definitely because there's so many. There's like MyFitnessPal. I know your watch does activity. If you have an Apple Watch or a Fitbit or Garmin, all of those different types, they do activity. A lot of these smart watches. I would say there are so many. I would just start to really research what works for you. I know, I'll be honest, there's probably like 10 or 12 on my phone right now. Some that I love and some that I've probably never opened since I first downloaded them. There's just so many. There's ones that will track your food and your activity. I would say start for what works for you. I know some of my friends literally just journal. So if you're a person that writes things down, journaling what you eat and how much activity you do works too. So I think it varies on like the person that you are. Like I do not put anything in an app. So I really need to download or get rid of all of the apps that are on my phone because none of them are being used. I have a dry erase board and that's what I do in my house. And I have like when I worked out, how much water I drink, and then put the meals for the week on that whiteboard as well. So it's planned out and we're very aware of what's going to be eaten at that time. Or if we don't plan it out, then so often it ends up being really bad. So those small things. But yeah, there's tons of apps. Some of them I just kind of find annoying. I don't like the notifications. So they're like, you didn't log your meal today. And I'm just like, I don't care. So those don't work for me, but they may work for some. But it doesn't have to be complex. Like do what works for you. And if it's a lifestyle change, then you don't have to log it as often because you're trying to make it normal. So for me, the apps don't work for me because I'm not going to go into an app because I don't want to. So like my phone is really like a phone for me, because I don't want to be on it if I'm not working. So I don't want it to be on the phone. I like it on a dry erase board in my house because then at the end of the week, I feel some type of satisfaction of like starting over and redoing it every week. So that's a personal goal. But yeah, there's tons of resources out there. So definitely just research whatever works for you. And if you have 10 apps and you don't use them all, you can just delete them like I should.
My next question is, how frequent is too frequent when consuming alcoholic drinks? Is there a specific number that is detrimental to heart health or a specific range?
I don't know the number for a week. I'm thinking, we all hear about a glass of red wine is not going to hurt anyone. And we hear that, but I do not know the weekly amount. And I don't want to say the wrong thing. I do not remember the amount a week, but I know when I think of just fitness overall, most often when we try to keep a limit of 2 drinks is what I've heard from most fitness and health. 2 drinks per week is like, you can indulge in alcohol, but you don't want to overindulge. That's what I've heard from the fitness side. But when I think about heart health, I don't know off the top of my head. So I can find that out and we can send it in follow up, but I don't remember. I'm not going to lie. I'm sorry.
No, that's okay. Perfect. Thank you. The next question is, at what age is it important to start focusing on heart health?
Oh, super early. Just think about it. So like youth, that's the most energy you'll ever have. And if you're active when you start younger and start being active, and you tend to not lose it if you continue that physical activity or you continue a lifestyle where you want to be active. So you want to try to continue that even as, you're a young adult and then adulthood, because it's very hard to then backtrack and say, well, I used to run. I even use myself. I used to run all the time. I loved running. But when I stopped running, it was so much harder to get back to normal when I didn't run for like years, or other than like getting on a treadmill. But if I was running 3 miles a day and now I'm struggling to run 1. So it's really important to start early and just be consistent. And the cool thing about, with youth it's really cool because they just like run around in circles. Like it's just being active. They have so much energy, right? And then they can turn into, organized sports or intramural sports or whatever the case may be. So really taking any opportunity to start being heart healthy. I would say in addition to that, for also diet, right? Obviously youth most often don't cook their own food. Their parents are cooking it for them. So incorporating those heart healthy meals is essential to knowing, how you hope to then continue, because then youth will then crave that type of food when they're older too. I always laugh with my mom because I'm like, I really like fresh vegetables. I have a thing. And I'm like, went back home from college and I'm like, Mom, is this frozen? Like, who are you? But it's like, that was my norm. I was expecting, fresh vegetables from my mom because that was all she loves going to the market. So the market was a norm. So fresh vegetables were a norm. So when you create those type of practices, then that's what youth will want to eat. So it's also physical activity, and then creating that healthy diet from the beginning is also really important too.
Thank you. Yeah, I think that's really important too, to Red Saree's mission of promoting a healthier and happier lifestyle for South Asians starting at an early age too, if possible, because these behaviors, if you establish them well, like you said, then they can follow you throughout your whole life. And
now I still don't really like which really gets me, because I wish I liked frozen vegetables a little bit more. They would just sit in the freezer because I don't really like them. So yeah, it's just so annoying. I wish I did sometimes. I'm like, it's so much easier.
I also want to thank everyone who's submitting such great questions, and I encourage everyone to continue to do so. We have about 10 minutes left in our session, so please ask any questions that you might have.
I'm going to meet them.
Oh, perfect. Thank you.
Okay. I think I have the power. Any other questions? What else can I ask? I'm like,
Angelica?
Yes.
Hi, Dr. Saree here. How are you doing?
Good. How are you?
Good. Wonderful talk.
Oh, thanks.
So, can you just talk a little bit about the whole social determinants of health and how that's very important for us now, especially given the COVID, and how a lot of people who may not have the means when it comes to really getting the care that they need. So thanks once again. It's great hearing you talk. And
thank you. Wait, do you know the answer to the alcohol question?
Yes.
So what is it?
So when you look at the data that's come out in terms of heart health, I would say 1 to 1.5 glasses of wine per day is all that is recommended for heart health, or 5 drinks per week.
Oh, it was 5. I'm going to tell my personal trainer that, because she told me to.
Well, for training, maybe if you're training for some endurance activity, then it's 2. If you're purely saying for heart health, the problem is very few of us can stop with 1 glass of wine per day, which is going to be very tough. So that's why, if patients ask me at work, I refrain, just like you, saying, well, we don't want you to drink regularly. So Dr. Suresh, can I have a glass of wine a day? And if it is only a glass of wine, I say, yes, you can.
Yeah. So, Thank you for that, because I was like, wait,
Thank you, Angelica, for doing this. So
no problem. Yes. So social determinants of health is my jam. So they are super important, even more now with this time with COVID-19. So social determinants of health are basically, or social influencers or health-related social needs, is basically everything that determines our health that is outside of our actual health behaviors and things that we cannot control most often. So often they are things like environmental factors. There are things like our education system. There are things like the access to healthcare, as well as economic differences. Socioeconomic status is a huge portion of it, and can go on and on and on. So these are factors that are putting our populations at risk before they even, like when they're born. So thinking about if a mom doesn't have access to healthcare, and that can be from being in a rural area to being in an urban area, if they don't have access to healthcare, then when let's just say a child is born, the child then does not have appropriate access, and let's just say the school system is not good, and we know there is this deep correlation between education and health, and the attainment of individuals with higher education as well as just proper education then to be healthier. And then when we talk about access, we most often in my role, we talk about food, specifically in the Greater Cincinnati area, where we have so many food insecure communities in neighborhoods, as well as outside of the city center. But food is essential. So we talked about having fresh vegetables and, preferring those. But so often many of my neighbors do not have the same access. And because of that, I think about how my heart health, my health overall is different because I'm able to get in a car and drive to go to the grocery store. And most often some of my neighbors have to take multiple buses or get a ride or things of that nature. And the only thing around my neighborhood are fast food restaurants, and most often fried food as a resource. So when we think about things like food, it's like a tangible, like, oh, wow, like this is a huge impact. And those things then, lead, we talked about how important healthy food is, and if you don't have access to healthy food because you live in a food desert is most often what it's called, or a food insecure neighborhood, then you're less likely to then have that access to those fresh fruits and vegetables that we said are essential to being heart healthy. So when we talk about social determinants of health, we can literally lay it over every single health concern that we've talked about from the beginning of time, and social determinants of health play a huge, huge role in that. And now here we are within COVID, and we have just seen how the comorbidities of COVID and individuals that have hypertension and, heart disease and various other illnesses are getting COVID, and then they're falling ill, and then they are dying, unfortunately. And we knew about this before. Social determinants of health are not new. This is something that and I say we as a country or we as a world have been studying for years, but we have never, since 1918, have not had a pandemic where we have seen drastically how it has taken whole communities away, and we control for everything else, right? We know that those social determinants of health and then lead to the racial disparities that happen within health, and the implications of that. So I go back to saying why science and data are so important, because when the data from COVID came out, it just said, wow, now we know. We've already known, but now there is no denying that access to healthy food, access to healthcare, access to education are huge factors when it comes to how we address social determinants of health and how we achieve health equity. And the terminology health equity, we want to provide resources and policies and systems, environmental changes that will then bring everyone that does not have those resources to have an equitable health access. And health, I use that as an umbrella term to include all of those things, to include adequate education, to include access to healthy food, to include access to healthcare, and what that means to a population of people. And it's complex, and we didn't get here overnight. And these things were created. And I forgot to mention housing is another big one. And so often it's tied to education, because education and tax dollars pay for each other, or housing pays for tax dollars for education and school systems. So the implications of living in certain neighborhoods and then not having access to that food and then not having access to education, all of those things then continue to couple and then lead to poor health. I often say people don't just wake up one morning and decide they want to be unhealthy, right? As a people, we want to live and thrive and grow and see our children and, families live and thrive and grow. But so often many of our neighbors do not have that same access. And, what can we do about that? And I say we as a collective, as a community, because there are people in education working towards that. There are people in the food industry working towards that. There are people in public health and healthcare working towards that. So it's all about all those people coming together. We cannot solve and really address social determinants of health in silos. It didn't work before. It's not going to work after. And we don't want to wait until another COVID-19 or another pandemic to happen to address the huge disparities that we have within our community. Sorry, I kind of went on a tangent, but I love social determinants. I hate them, but I love addressing them because they are super important to really improving our community overall.
Thank you, Angelica. Thank you.
No problem.
Okay, well, I think that this may be a really great final question, just based on the time, but recognizing the importance of all of your recommendations, if you only did one thing to help improve your heart health, what would it be?
Like my personal thing, or?
Yes.
A glass of wine a day.
No, I'm only do 2 drinks because that's what she told me. Now I know I'm going to tell her that, I said I could have 5 drinks a week. A glass of wine a day is a good one. I would say starting with sleep. I really would. It's not a super heavy lift, and I think people are encouraged by small wins. So if you are a person that's getting 4 hours of sleep a night, 4 or 5 hours, like how do you get to restful 6 to 8 hours of sleep? I know, and I say a lot of my peers in my network do not sleep. And I'm like, how are you guys not sleeping? And we're like younger, like you guys need to learn how to sleep now because, we're only going to have more kids and more distractions and things of that nature. And those are going to make it very difficult to find sleep. So how do you create a healthy sleep schedule? Because then you can, that's an easy win. And I like small, easy wins. Check, write it off my to-do list, as I mentioned in the healthy habits, and then go on to the next thing. And if that's eating healthy for you, figure out what that looks like and start incorporating more plant-based diets. We talked about, maybe picking a day and then go into okay, I'm walking at least every day at a certain time for this amount of time. And then you can start running 5Ks and marathons and go on the vigorous activity, So I would say start with sleep because it's a very tangible, easy thing to really just monitor. If you have one of those smartwatches, some of them even measure sleep, but see how long you're sleeping and having restful sleep, and then figuring out how to improve that, and then go and knock out the diets. So often I think we're also doing something healthy, we're eating healthier, but we want to, knock something off, make sure you're sleeping right, and then wake up in the morning and conquer everything else.
Thank you. I really liked what you said about small wins. And I know as a student, I should take your advice on the sleep.
Yes. See, you need to sleep now because it's going to get worse.
So it's a final question, but we actually have one more.
No problem.
That's okay. Do food deserts drive heart disease incidence, and what is the American Heart Association's position on this?
Do food deserts drive heart disease? Oh yeah. So often we can see the zip codes of we can layer zip codes of individuals that have passed from heart disease, and these are older data sets mainly because so often people still live in those zip codes. But we can see the mortality of heart disease layered with area codes or zip codes where there are food deserts. And food deserts by definition is having a access to food either a mile or more, a mile walking and 5 miles driving or transportation by bus, etc. So it's the distance, right? How long, or it's more of a 20-minute walk. So that can be different wherever you are. So if it's more than a 20-minute walk, I don't know how many people have carried groceries for 20 minutes back home from a store. It's a lot of work, especially if you're getting groceries for an entire family. But yes, because we know the implications of not having healthy food to heart disease, we know there's definitely correlation between heart health and food deserts. And that's why not just us as, the American Heart Association, but so many other organizations are working for food insecurity within our communities. I think that's kind of the best part about it, which I really enjoy, is that it's not like all the weight is on one partner, one nonprofit, one organization's shoulders. Around the country, we are also working on this with so many other partners. There's also been a lot of entrepreneurs that have had businesses grow out of the food insecurity market. I love Chicago's, I can't think of what it is, but they made an old school bus into a market that travels. And we have something similar with Free Store Food Bank here in Cincinnati, but this was like a small entrepreneur have a garden that they have really in the city of Chicago somewhere, and then they bus it to various different neighborhoods in Chicago. So these entrepreneurial efforts are born out of the need to provide healthy food and different access to fresh fruits and vegetables. And literally that's all that the bus has on it. It's like it has a little weighing thing, so you can weigh your vegetables and they ring you out. They also take SNAP, so they have the access to take different SNAP benefits as well if needed. And then people have access to healthy foods, and we don't have to worry about trying to get on the bus or get a ride or some type of transportation or walking, if even walkable, to then get that. So that, yes, there's definitely a huge correlation between the two.
Well, once again, thank you so much, Dr. Hardee, for taking the time to help us to further the mission of Red Saree, which is to help promote a healthier and happier lifestyle for all South Asians. It was such a pleasure to listen to your informative presentation, and I thank Red Saree for the opportunity to serve as your moderator today.
It was so much fun. Thank you all so much. I really enjoyed it.
And thank you to everyone who tuned in to today's session. And please remember to go to the Red Saree website, Facebook page, and YouTube channel to watch other recorded webinars from this series and to find out more information about how you can achieve a healthier and happier lifestyle. Thank you, everyone.